Hello, welcome to my presentation about employee burnout among firefighters and paramedics. In this presentation, I will cover some background about burnout, occupational hazards that cause burnout, causes of mental illness in first responders, the Schaumburg Fire Department, Schaumburg's department challenges regarding burnout, the department efforts regarding burnout, and some recommendations, and then I will follow it up with a few questions. The term burnout was coined in the 1970s by an American psychologist named Herbert Freudenberger. Symptoms of burnout include exhaustion, alienation from work-related activities, and reduced performance. Burnout can also lead to serious mental health issues like depression and anxiety. The Mayo Clinic defines burnout as a special type of job stress, a state of physical, emotional, or mental exhaustion combined with doubts about your competence and the value of your work. Firefighters and EMS professionals are some of the people most likely to experience burnout and the myriad effects that are associated with it. Firefighters and EMS professionals regularly find themselves in stressful situations during their workday because they respond to emergency situations such as fires, domestic violence, child abuse, school shootings, and major disasters. First responders are required to answer all emergency calls, regardless of the time of day or the actual need for a call. The stress of responding to every call adds up over time because of the way that the call disrupts routine and sleep schedules. Other occupational hazards for first responders that can lead to burnout include a greater risk of death and injury and death of a coworker. Recent evidence in the mental health field shows that chronic stress predisposes the brain to mental illness. Researchers have found that chronic stress creates long-lasting changes in the brain structure by affecting the amount of gray matter, which is the part of the brain that stores and processes information, versus white matter, which is a network of fibers that interconnect neurons. People who suffer from stress-related mental illness, such as PTSD, have an excess of white matter in their brains. This change in white matter is also found in other conditions such as schizophrenia, depression, and suicidal tendencies. The prevalence of stress that first responders experience as a result of their occupational hazards is enough to cause these types of mental illnesses. Another component of developing mental illness is a lack of coping skills. Coping with stress is defined as all activities undertaken by a human in a stressful situation. Coping skills can have either positive or negative effects. Studies have shown that a lack of positive coping skills to psychological strain is directly related to mental illness and suicide. Most firefighters do not receive any education or training of coping skills to deal with the stressors of their job. Most do not seek services to help with burnout because of a stigma attached to seeking help. The combination of this chronic on-the-job stress and lack of treatment has led directly to the prevalence of mental health issues in the fire and EMS services that we see today. In a study conducted by Dr. Dutton and the University of Phoenix, 85% of the first responders in the study had experienced symptoms related to mental health issues. In the same study at the University of Phoenix, 84% of responders said that they have experienced a traumatic event on the job. These traumatic situations are often the cause of one of the most prevalent mental health issues for first responders, post-traumatic stress disorder, or PTSD. PTSD is caused by chronic stress and first-hand trauma-inducing situations. Symptoms of PTSD include guilt, shame, self-blame, depression, hopelessness, suicidal ideations, flashbacks, and even physical aches and pains. Among firefighters, the rate of diagnosable PTSD is about 16.5%, and the rate of PTSD among all first responders is about 10%. The rate of diagnosable PTSD among the general public is only about 1% to 3%. Another mental health issue among first responders that is directly linked to burnout is depression. Depression is a mood disorder that can affect how a person thinks, feels, handles daily activities. A person suffering from depression can experience symptoms such as feelings of hopelessness, pessimism, irritability, decreased energy, and attempted suicide, among others. According to the University of Phoenix, 27% of first responders have been diagnosed with depression. Among the first responders that have been diagnosed with depression, nearly half cited incidents at work as a contributing cause. Prevalence of suicide among firefighters has only recently been tracked. In 2014, there were 88 firefighter suicides that were documented. A survey of 4,000 first responders in 2015 found that 6.6% of first responders had attempted suicide. This is more than 10 times the rate of the general public. In 2016, 132 first responder suicides were reported to the Firefighter Behavioral Alliance, which helps firefighters cope with the stresses of their job. According to this organization, these voluntary reports may only be capturing about 40% of suicides that are actually happening. Schaumburg Fire Department, which is located in Schaumburg, Illinois, employs roughly 120 firefighters and paramedics. About 70% of these employees are both firefighters and paramedics. The rest of the employees are either a paramedic or a firefighter. The majority of burnout from Schaumburg employees happens as a result of the paramedic work. Non-emergency calls, interrupted sleep, the number of calls in a day, the time spent on a call, repeat overdose patients, and repeat patients or frequent flyers are some of the job factors that paramedics will deal with and firefighters may not deal with in the same capacity or at all. Usually firefighters will handle a smaller number of calls, and they are usually at a call for less time. Seeking for mental health issues among firefighters and paramedics is heavily stigmatized at Schaumburg Fire Department. Some employees are mocked when they express having mental health issues. Other fears include others fear being passed up for a promotion or not being allowed to go on certain calls. Some firefighter paramedics fear that they might not be given certain responsibilities or that they'll be seen as weak by their supervisor if they are outspoken about their mental health issues caused by burnout. This causes many firefighter paramedics to stay quiet about their issues. Many firefighter paramedics are still in the closet regarding their challenges with burnout and mental health issues. There are many challenges that the department faces because of burnout among the firefighter paramedics at Schaumburg. One of the challenges is the suffering of the service to the community. An employee who's burned out is much more likely to make mistakes on the job. Burnout can lead to mistakes such as improper diagnosis or treatment of a patient. A burned out employee is also more likely to mistreat patients and provide poor customer service. Another challenge for the department is employee turnover. Many employees will leave the position early as a result because they are not able to handle the position, and this results in an understaffed department and also results in more money required to hire and train new employees. Another challenge for the department is drug and alcohol treatment. It is not uncommon that first responders for Schaumburg will cope with the stress of their job by using drugs or abusing alcohol. It is also not uncommon that Schaumburg will pay for treatment if a firefighter is showing signs of addiction, such as multiple arrests for drunk driving, or showing up to work intoxicated on a regular basis. Schaumburg's fire department has an employee assistance program, which is one of their efforts to handle the burnout issue in the department. This is village-wide, and it's available to all employees, which makes it largely ineffective for firefighter paramedics as it does not address their specific needs. Another effort from the department includes talking to an employee if the employee shows obvious signs of burnout, but usually there is little to no follow up. Other than this, burnout is not addressed. I have some recommendations for the department to handle the issues caused by burnout. Currently, the Village of Schaumburg offers its fire department a relatively comprehensive health benefits package, but when it comes to mental health coverage, the benefits are lacking. Um, Offering employees a benefits package that includes more in-network psychologists and a lower deductible and alternative therapies such as massage, chiropractic care, and acupuncture would make it easier for firefighters to seek help for burnout. Another employee benefit that could help with this problem is offering mental health days. The average work week for a firefighter paramedic in Schaumburg is 50 hours a week. They receive vacation and sick days, but the sick time is for physical illness only. They do not receive personal days. Including mental health days and employee benefits would allow extra time to deal with the stressors of the job. Currently, Schaumburg Fire Department has no training or education for its firefighter paramedics to prevent burnout and its adverse effects. Offering a class that allows firefighter paramedics to reflect on how they cope with stressors of the job could help prevent burnout. In this class, firefighter paramedics can learn to identify the ways that they cope with stress, and then learn about new techniques and analyze which techniques work best for them. These courses could be implemented on twice a year or every 6 months. Another way to implement training or education on mental health issues is through the employee evaluation. The firefighter paramedics of Schaumburg are required to go through a physical evaluation during the hiring process. Once the firefighter paramedic is hired, however, their mental health state is not addressed at all unless an issue arises and the issue is directly related to mental health issues. The firefighter paramedics of Schaumburg go through an employee evaluation every 6 months, but the evaluation addresses physical issues only. It does not address mental issues. Adding questions about the mental state of firefighter paramedics would allow management to have a more thorough idea of how the department is being affected by the mental and emotional trauma of the job. It could also act as a learning opportunity for the firefighter or paramedic themselves to gain more awareness of how they are being affected by the stressors of the job. Schaumburg Fire Department currently has 120 first responders employed. The department is currently underemployed. Inadequate staffing, especially for first responders, the first responder professions that carry a heavy workload can absolutely result in burnout. Inadequate staffing results in more overtime for employees and more responsibilities on the job. Schaumburg Fire Department can help reduce the risk of burnout on its employees by increasing the number of firefighter paramedics from 120 to 140, which is what their local fire union recommends. Another way Schaumburg can help reduce the risk of burnout among its employees is through a predictable policy that would allow paramedics to drop their medic license after a certain period of time. The number of paramedics in the department changes drastically and without warning. For the employees, this inconsistent and unpredictable pattern makes for an even more stressful work environment and creates a feeling among paramedics that they don't have control over their position. Schaumburg Fire Department could issue a policy that states clearly when paramedics can drop their license and how many paramedics should be employed at all times. This policy will give the paramedics of Schaumburg more predictability and autonomy in their job. And finally, I have just a few questions. What else can be done to protect against employee burnout? Does your job offer ways to reduce stress in the workplace? How often do you feel overwhelmed because of your job? And finally, what ways can we encourage conversations about employee burnout and mental health issues? And here are, here are my references. And that's the rest of my presentation. Thank you so much for listening.